You visit a doctor, you get a diagnosis, and you receive a prescription. You believe this is a cycle of healing, a noble pursuit of biological maintenance. You view your health as a personal matter, a private sanctity protected by the Hippocratic Oath. But if you strip away the white coats and the sterile clinical environment, you are looking at a raw data harvesting machine. Welcome back to Wealth Wisdom Man. Today, we are not talking about medicine. We are talking about the ultimate arbitrage, the systematic conversion of your human life cycle into a tradable financial instrument. Wall Street has realized that the most valuable commodity on earth isn't oil, silicon, or gold. It is your diagnostic history. Your health is no longer a personal concern, it is a high-growth asset class for the invisible cartel. We are living through an era where the boundary between human life and financial output is being erased by algorithmic precision. The transformation of medicine into an industrial data farm didn't happen by accident. It is enforced by the modern corporate aristocracy. Modern hospitals are no longer houses of healing, they are nodes in a massive, interconnected network of data extraction. The mandatory implementation of electronic health records, EHR, was the turning point. This is not merely an efficiency measure, it is a strategic requirement to turn subjective human biology into a machine-readable format. By forcing hospitals to adopt centralized, interconnected digital registries, they have created a global pool of real-time biological data. Just as 19th-century monopolists built railroads to control the physical movement of goods, 21st-century asset managers build digital health infrastructures to control the movement of your biological information. Why are healthcare systems globally synchronizing their data standards? Why are hospitals in Asia, Europe, and America suddenly speaking the same digital language? Look at the ESG mandates pushed by BlackRock, Vanguard, and State Street. ESG, environmental, social, and governance scores, is not about saving the planet. It is the institutional enforcement of data standardization. By linking institutional capital access to ESG performance, these giants force medical institutions to report standardized, digital metrics. This data is then aggregated into massive, centralized warehouses, becoming the raw material for predictive modeling. They need you standardized, digitized, and predictable. Without this uniformity, their algorithms cannot effectively calculate the lifetime value of a human asset. Aladdin, the central nervous system of global finance, is now being fed biological data. Imagine an algorithm that manages over $21 trillion in assets. It doesn't just track stock prices, it tracks systemic risks. Your health is a systemic risk. If their algorithms can predict your chronic illness 5 years before you experience symptoms, they can hedge against the associated costs and profit from the inevitable medical expenditure. They are not waiting for you to get sick, they are pricing your sickness into the market years in advance. This is the financialization of human endurance. When your hospital visits are fed into the same predictive engine that prices sovereign debt, you are no longer a patient, you are a variable in a risk management model. Consider the real-world architecture of the modern medical-industrial complex. Take the closed-loop system between large-cap insurers like United Health and the pharmaceutical giants they heavily invest in. When a clinical guideline is updated, say, lowering the threshold for what constitutes high blood pressure or prediabetes, it isn't just a medical breakthrough. It is a calculated market expansion strategy. By lowering the threshold, they instantly reclassify millions of healthy individuals as patients. The insurance firm collects higher premiums for risk management, the pharmaceutical company sells lifelong medication, and the institutional shareholders, the same group that owns both companies, reap the compound growth. How are these medical guidelines actually created? Look behind the curtain of the independent medical committees. You will often find a direct overlap between those who define what is healthy and those who own the patents on the drugs used to treat unhealthiness. This is a conflict of interest built into the very architecture of modern medicine. When you understand this, the rapid increase in chronic diagnostic rates is no longer a mystery, it is a logical outcome of a system that maximizes shareholder returns by maximizing the number of diagnosed patients. This is the horizontal ownership structure in action. It neutralizes true free market competition and ensures that the system as a whole always benefits the owners of the infrastructure. We are entering an era of biocapital derivatives. Just as mortgage-backed securities packaged risky debt in 2008, healthcare outcomes are being packaged into complex financial products. If a population's health data suggests a high probability of expensive treatment, that risk is sold as a financial instrument to institutional investors. Your biological decline is now a tradable variable. They are essentially betting against your vitality, turning your mortality into a predictable stream of revenue. Your diagnostic file is a map of future cash flows, and the elite are building a market where they can bet on the timing of your medical exit. Why is the tech industry so desperate for you to wear an Apple Watch, a Garmin, or a Fitbit? It is the final mile of data extraction. These devices bridge the gap between the doctor's office and your private life. They monitor your heart rate, your sleep, your stress, and your activity, feeding this real-time stream into the same databases that inform your insurance premiums. You are paying for the privilege of being surveilled, effectively subsidizing your own actuarial evaluation. Your smart devices are not tools for your health. They are sensors for a global network that views your activity level as a data point in a broader risk optimization algorithm. Throughout history, mortality was the only absolute equalizer. Wealth could buy power, land, and comfort, but it could never buy an escape from time. Death always settled the ledger at the exact same finish line for both king and peasant. The Longevity Cartel changes this foundational equation. As cellular reprogramming and epigenetic computing commercialize, capital will no longer be an external asset, it will translate directly into physiological lifespan and cognitive endurance. Society risks fracturing into two distinct biological classes, an immortal elite with unlimited time to consolidate systemic power, and a baseline population whose lifespans remain bounded by nature while their biological data is systematically harvested. The history books will never teach you this. They will tell you that pharmaceutical advancement is the peak of human ingenuity. But now, you know the clinical reality. You are living in a system that thrives on the commodification of your existence. How do you protect your autonomy? You must treat your medical data as the most sensitive financial secret you possess. Stop feeding the machine with wellness data for the sake of convenience. Understand that every free health tool is a transaction where you are the product. The matrix wants you monitored, optimized, and predictable. To remain free, you must learn to live outside their model. Protect your time. Invest in your mind. Subscribe to Wealth Wisdom Man, and continue to decode the invisible system. Remember, the true architect of your life should be you, not an algorithm calculating your exit date from this world.